And our final panelist this morning, Ellie Smeal, president of the Feminist Majority Foundation. For 30 years, she's played a pivotal role in the modern women's rights movement as a political strategist and grassroots organizer. Smeal leads the Feminist Majority's efforts to promote women's rights as a central feature in U.S. foreign policy, particularly policies which enhance the economic and political power of women and ensure access to family planning. Ellie?
The whole time I was listening to Dr. Orero and Dr. Sadik, I'm struggling to how do you wrap this up and how do you paint the picture of the suffering. Dr. Orero has so vividly pictured it not only here but in many different platforms that he sees on a daily basis. We throw out numbers. But I don't think we can picture what each number means. 70,000 women annually die of unsafe abortion needlessly and we contribute to that mayhem. 70,000. Picture it. Picture what that means. Day in and day out, deaths unnecessary. We talk about women, but Dr. Orero has mentioned repeatedly that we're talking about 12-year-olds, 13-year-olds, 15-year-olds. We have an international policy, we, the United States, in our funding, which we talk about abstinence only. But the women and girls who want access to family planning are married women. 200 million, and I think those numbers are underestimates. We're talking about a culture where a girl can be pledged to marriage at the age of 10, be married at the age of what we would consider preteens almost, 14, 15 years old. And we're talking about her being able to negotiate abstinence only in a marriage. I mean, it's not possible. And yet, for some of these young girls and women, the very getting pregnant is almost like signing a death warrant because the rising numbers of young girls dying and young women dying. In Afghanistan, a country we promised a Marshall Plan, today, not some other day, today, 1 in 6 women will die because of a pregnancy. 1 in 6 over the course of their life. 1 in 6 will die. In the United States, it's 1 in 2,900. In Sweden, that has access, universal access to health care and to contraception, it's 1 in 29,000 that will die. So you are having all these unnecessary deaths, but we're not even counting the suffering. Thousands upon thousands, millions suffering needlessly. 500,000, when you say 529,000 needless deaths, that's according to the UN, a year from pregnancies, which could be prevented, complications of pregnancies. Then think of the millions who are injured. Both of these doctors have seen healthcare systems in which there are more women in the maternity ward because of injury or fighting death from unsafe abortion than are there for the pregnancy of a delivery. These unsafe abortion beds or wards are taken from a system that is already stressed. So people are dying and suffering needlessly. Now let's look at our policies. We give less than 2% of our international development aid to family planning, even though we know that it saves lives and is the best single investment we can make. We then tie into it policies of this global gag rule, which withholds contraceptives right now, as Kathy said. I think it's actually from 16 developing nations, because they cannot comply with this rule. And something like 13 major family planning agencies, creating more crisis to overworked systems. So what's happening with the women's movement is we're determined to get rid of the silo that puts domestic family planning and reproductive health policies in one little basket and international into another, and to understand the whole of it. Because as we are cutting family planning access globally through our policies, by cutting in real dollars, even though the population is expanding, we're now 6.5 billion, and we were when I was in, it wasn't 100 years ago either, although some days it feels that long. It was like a couple billion people. We're now at 6.5 billion people. So the needs keep going up just by the sheer quantity of people. We are decreasing in absolute dollars by 40%. And we are doing the same thing domestically. As our population has increased from the mid-50s to something like 150 million to now over 300 million, we are decreasing in absolute dollars access to family planning to the poorest of poor in our own country, rising the need for abortion. In fact, on the excuse of abortion, they are creating policies that are increasing the need for it, and in fact the incidence of it, and of course the suffering and the lack of health resources. So we are organizing to try to reverse these policies, and I think somehow we have got to put on the table the horrid suffering of the young and poor women here in our own country, but mostly right now where you can see it most clearly in the developing world. We have to do something now. And it doesn't matter who the president is. It doesn't matter who the Congress is. We have to organize to create the will and the need for the change and to reverse these disastrous policies. Right now, in both houses of Congress, we do not have a majority on many reproductive health policies yet. We certainly don't have it for legal abortion, and clearly we do not have the will to create the priority to increase the funding. And we brag about how much we're giving to aid policies fighting HIV/AIDS, but we're now starting to put restrictions on it so that the global gag rule is getting snuck in, or at least there's an effort to do it. And when you think in terms of Africa, that the face of AIDS is now a woman, what are we doing by putting restricted policies that will just make the suffering worse? We cannot afford this thinking and this silo thinking. And so we're not going to. We're organizing on college campuses. We're organizing in women's communities. There are so many organizations now who are getting the gestalt that our policies are contributing to mayhem, to injury, and to death needlessly of young girls and young women throughout the developing world, and we are determined to help to reverse it.
Thank you, Ellie.